Welcome back. Now, the SA Medical Association maintains that if the National Health Insurance Act is implemented, it could collapse the country's healthcare system altogether. The formation is gearing up for major legal action against this piece of legislation post the Pretoria High Court ruling against the introduction of low-cost benefit options to the sector. Dr. Mvuyisi Mzukwa, chair of the SA Medical Association, joins us with more detail. Thank you so much for your time, Dr. Mzukwa. Now, just paint a picture of the violations of constitutional rights that the SA Medical Association has identified.
Good afternoon to you and to your listeners, and thanks for having me. There are a number of issues that we've identified. One, it is the excessive bureaucracy and limited access to care. And the other one is unclear benefits and healthcare funding model, the negative impact on healthcare professionals, and also the negative impact on patients. And on top of that, we've had a proposal that we've brought forward to the president.
Yeah, well, just drill into these for me, and let's start off with the negative impact on patients, because I mean, the NHI has really been presented as legislation that is supposed to level the playing ground in terms of, the poorest people can actually get quality healthcare, something that a lot struggle with in this current landscape.
First of all, if we're looking at the registration, it says that all South Africans will be expected to register, before they have access to, a healthcare service. Now, you will know that we've got serious challenges when it comes to registering people in South Africa. There are children today who cannot access grants, elderly who cannot access grants because of registration issues. Now, if you are telling me that somebody must be registered before being assisted, then it's a limitation to healthcare, to access to healthcare. But also the issue of the infrastructure. We've been insisting since 2015 that we, as the country, must have an electronic health record that is going to be used anyway, as a person. But that has not been implemented up until today. So a question is now, if you put it on law, it becomes a law of the land that unless you are registered, because this affects you even if you have an emergency. It means if you have a medical emergency, you cannot be assisted because you are unregistered.
Ooh.
So there are no exceptions. There are no exceptions at all, regardless of the challenges that we face.
Yeah. So it really just emphasizes that something that could be an administrative issue that we currently struggle with could actually affect people's lives. Let's actually get into the impact of doctors, because we know that even under the current healthcare system, there are many doctors that are unemployed, lots of issues there. Talk to me about what you have identified in terms of the challenges that doctors could face under the NHI.
Well, it relates to the accreditation standards that are expected, from the doctors. And I point out the issues where the terrain is not the same. For example, if some professionals are in the rural areas and the accreditation says, unless you have running water, we are not going to accredit you. So how is that person going to be accredited? Because in the area where the practice is, there is no running water. So you've got to look at those realities on the ground before you say this is law. Everybody must be, must fall in line. But also, if you look, for example, at the specialists like surgeons and anesthetists, already, they are beyond capacity. So if without making sure that you have enough of those, and you say those people must continue, I mean, it's not only going to be burnout, it's just people going to collapse, people going to die from depression, like we have seen already in our country, where healthcare workers are subjected to mental illness because of the challenges of the system. So without resolving those other pillars of a healthcare system, you can't just say you have an NHI that is going to be assisting communities. So if you look at, but also medical aid patients, not only medical aid patients, but patient COIDA, those that are supposed to be benefiting from the medical aid in the mines, and all those people are going to be dependent on the ill-defined NHI in terms of benefits. So you've got people who are covered now who are not going to be covered when it comes to NHI because the benefits are not defined. So those are the challenges we're pointing out, that it's an impact on the patients and the professionals as well. But also, remember, these professionals will be dependent on the protocols that will be developed by the NHI fund, to execute their clinical duties.
Yeah.
Now, who is going to be taking liability then? If there's issues of litigation, who is going to be covering the medical malpractice, as it is called? Because even now, we're struggling with issues of litigation. So how do I put myself where I cannot independently use an evidence-based medicine? And I'm told by the protocol that no, because we're saving money, don't use this type of medication to this patient. Use this one, knowing which this one can actually work, and I know there's evidence. So only because it's expensive. Who takes liability if you are coming after me litigating for malpractice?
Well, it seems to me that the narrative under the implementation of the NHI has been to build the plane while flying it, but it seems that in the South African context, we actually have to build it before we fly it. Thank you so much for your time and for your insights today, Doctor. Really appreciate it. That was Dr. Mvuyisi Mzukwa, Chair of the SA Medical Association.